Hello everyone, welcome to today's video on understanding Oppositional Defiant Disorder, otherwise known as ODD. My name is Trish Schneider and I will be guiding you through this comprehensive guide. Oppositional Defiant Disorder, or ODD, is a complex behavioral disorder that affects children and adolescents. It's characterized by a pattern of negative, hostile, and defiant behavior, which can cause significant distress and impairment in daily life. So let's look at what these symptoms are. Common behaviors include deliberate annoyance or upset of others, blaming others for mistakes, refusal to comply with rules or requests, intentional annoying or upsetting behavior, and spiteful or vindictive behavior. Now, diagnosing ODD requires a comprehensive evaluation by a qualified mental health professional. The evaluation will assess the child's behavior, emotional functioning, and relationships with family and peers. Treatment for oppositional defiant disorder typically involves a combination of behavioral therapy, parent training, and medication. Here are some treatment options. Behavioral therapies. Parent management training. So this teaches parents skills to manage their child's behavior, such as positive reinforcement and discipline techniques. Cognitive behavioral therapy, or CBT. This therapy helps children identify and change negative thought patterns and behaviors. Functional family therapy focuses on improving communication and problem-solving skills within the family. Multidimensional treatment foster care, a type of foster care that provides intensive behavioral therapy and support. Now, there's also parent training, such as parent-child interaction therapy. This teaches parents skills to improve communication and relationships with their child. Incredible Years Parent Training. This is a program that teaches parents skills to manage their child's behavior and improve relationships. Medications. Stimulants may be prescribed to help manage symptoms of ADHD, which often co-occurs with ODD. Mood stabilizers. These may be prescribed to help manage irritability and mood swings. And antipsychotics. These may be prescribed in severe cases to help manage aggressive behavior. There are also some alternative therapies, such as mindfulness-based therapies. These can help children develop emotional regulation skills and reduce stress. Animal-assisted therapy. This can help children develop social skills and improve relationships. There's also art therapy, which can provide an outlet for children to express emotions and develop self-awareness. There are also some school-based interventions, such as individualized education programs, or IEPs, which can provide accommodations and support children with ODD. Behavioral intervention plans can provide a structured plan for managing behavior in the classroom. And there's also some social skills training, which can help children develop the social skills and improve relationships with peers. Other types of treatments include residential treatment. So residential treatment centers provide intensive therapy and support for children with oppositional defiant disorder. Again, more severe ODD symptoms. Therapeutic boarding schools provide a structured environment for children to receive therapy and support. Now, diagnosing oppositional defiant disorder requires a comprehensive evaluation by a qualified mental health professional, such as a psychologist, psychiatrist, therapist, or a psychiatric nurse practitioner. Here is a step-by-step guide on how ODD is diagnosed. The diagnostic criteria for oppositional defiant disorder, they're outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. In order to meet the diagnostic criteria, a child or adolescent must exhibit at least 4 of the following symptoms for at least 6 months. First, the child or adolescent deliberately annoys or upsets others, such as by teasing, taunting, or provoking. 2, the child or adolescent blames others for their own mistakes or behaviors. 3, the child or adolescent refuses to comply with rules or requests from authority figures such as parents, teachers, or caregivers. 4, the child or adolescent engages in intentional, annoying, or upsetting behavior such as making faces, sticking out their tongue, or making rude gestures. And the child or adolescent exhibits spiteful or vindictive behavior by seeking revenge or trying to hurt others. Now, in addition to the duration of the symptoms, the frequency and severity of the behaviors are also important considerations in diagnosing oppositional defiant disorder. These behaviors must be frequent, so the behaviors must occur frequently, such as several times a week or daily. Severe. The behaviors must be severe enough to cause significant distress or impairment in social, occupational, or other areas of functioning. Now, the diagnostic evaluation for oppositional defiant disorder typically involves a clinical interview. So a comprehensive clinical interview with a child or adolescent, as well as their parents or caregivers. Behavioral observations of the child or adolescent in different settings such as home, school, or in the clinic are also assessed. Rating scales and questionnaires. So completion of standardized rating scales and questionnaires such as the Oppositional Defiant Disorder Rating Scale or the Child Behavior Checklist. And then psychological assessments such as cognitive and emotional functioning tests to rule out other potential diagnoses. Now, the mental health professional will also conduct a differential diagnosis, and this is to rule out other potential diagnoses that may be present with similar symptoms, such as attention deficit hyperactivity disorder. ADHD can present with similar symptoms of impulsivity and non-compliance. Conduct disorder. Conduct disorder can present with more severe symptoms of aggression and antisocial behavior. Mood disorders. Mood disorders such as depression or bipolar disorder can present with similar symptoms of irritability and mood swings. Now, after completing the diagnostic evaluation, the mental health professional will provide a diagnosis and recommend treatment options. Treatment for oppositional defiant disorder typically involves a combination of behavioral therapy, parent training, and medication. Here are some parent strategies for managing oppositional defiant disorder behaviors. Number 1, positive reinforcement strategies. Catch them being good. So praise your child when they exhibit positive behavior such as sharing or using good manners. Next, use positive language. Speak in a positive, respectful tone, focusing on what your child is doing right. Offer rewards and incentives. Establish a reward system to motivate good behavior such as stickers, stars, or special privileges. Create a positive reinforcement chart. Develop a chart to track and reward positive behavior, helping your child see their progress. Next, clear boundaries and expectations. Set clear rules. Establish simple, concise rules and expectations, ensuring your child understands what is expected of them. Next, use natural consequences. So implement natural consequences for behaviors such as cleaning up a mess or losing a privilege. Provide warnings and reminders. Offer warnings and reminders before consequences are imposed, helping your child prepare and make better choices. Stay calm and consistent. Remain calm and consistent when enforcing rules and consequences, avoiding power struggles and emotional escalation. Emotional validation and empathy. Acknowledge and validate emotions. So recognize and validate your child's emotions, helping them develop emotional regulation skills. Use empathy. Show understanding and empathy towards your child's feelings, encouraging them to express emotions in a healthy way. Teach emotional regulation skills. Help your child develop emotional regulation skills such as deep breathing, counting, or physical activity. Model healthy emotional expression. Demonstrate healthy emotional expression yourself, showing your child how to manage emotions in a positive way. Now, here are some communication strategies. Use active listening. So listen attentively to your child, ensuring you understand their perspective and concerns. Ask open-ended questions. Encourage open communication by asking open-ended questions, helping your child develop problem-solving skills. Now, open-ended questions is a question that your child has to answer in a sentence. So instead of saying, for example, did you have a good day today, which is either yes or no, you want to ask it open-endedly, such as, tell me about your day today. So that's going to require more than just yes or no. So that's open-ended question. Avoid power struggles. Refrain from engaging in power struggles or arguments. Instead, focus on finding solutions and compromises. Practice problem solving together. Collaborate with your child to identify problems and develop solutions, promoting critical thinking and responsibility. And the last thing I wanted to mention for parents is about self-care and stress management. So prioritize your own self-care. Make time for activities that nourish your body, mind, and spirit, helping you manage stress and maintain a healthy perspective. Also seek support. Reach out to family, friends, or support groups for help and guidance, recognizing that parenting a child with ODD can be challenging. Take breaks and practice self-compassion. Allow yourself time to rest and recharge, treating yourself with kindness and compassion when faced with difficult situations. Stay organized and manage stress. Develop strategies to manage stress and stay organized, such as using calendars, to-do lists, or stress-reducing apps. By implementing these strategies, you can develop a more positive, supportive relationship with your child and help them manage their ODD symptoms more effectively. Thanks so much for watching. Make sure to like and subscribe to watch further content on mental health topics for children. And also, be sure to check out and download my free guide, 10 Strategies to Calm Your Child's Tantrums. I'll see you in the next video.